protects, and the benefits of wearing a mask, the harmful aspects of wearing a mask. I've had someone propose a question to me. Actually, she made a statement saying that the masks are not for me or the wearer, it's for the other person's protection. So what are your thoughts on that?
In the context of coronavirus and the disease that it causes, COVID-19, the mask is very important for all parties concerned because this is an airborne virus. By that, they use the term an aerosol, which means that it can be spread through sneezing, it can be spread through coughing, it can be spread through just breathing in close quarters with other people. Masks in themselves, the surgical mask, is usually, conventionally, the surgical mask was used for physicians who were performing body surgeries where the person's body was being surgically opened. And so to help minimize disease, bacteria from getting into the person's body directly, either from the physician or from the environment was sterilized. The table is sterilized, the room is sterilized, the surgeons are wearing gloves, the nurses are wearing gloves, the physician's assistants. Everyone is wearing some kind of protective gear, what they're now calling PPE, which personal protective wear that they will wear inside a hospital setting. So it's not just about the mask in terms of its protective properties, if we can use that word to generalize the use or purpose of the mask, but it was to prevent the surgeon or those that was aiding the surgeon from passing on any kind of disease to the person which was receiving the surgery. That is the conventional use of a mask. However, we're talking about a virus. And when you're dealing with viruses that are contagious, that can skip from one person to another, either through an airborne means, which is breathing, coughing, sneezing, or being in the same close quarters again with someone who's infected. That person can be what is called asymptomatic, which is not showing any outward symptoms of sneezing and coughing, which are the typical signs of pulmonary distress. Distress of the lungs, mucus in the lungs, where the virus likes to take root. This particular virus, coronavirus, situates itself in both lungs, like a double pneumonia. It situates itself in both lungs. So it has a very serious impact on the respiratory system. If you're thinking conventional mask, yes, for the conventional purpose of the mask, then you would say in surgery. Use the mask in surgery to protect the patient from being exposed to any possible diseases or germs that a physician would pass on to them, or the ones that are working with the physician. But in a virus situation, viruses are handled by specialists, either virologists, epidemiologists, immunologists. Those are the people who will be involved in handling a virus, and their protective wear is a lot different. They're going to wear a surgical mask. They're going to wear a bodysuit, what you're hearing about in terms of protective clothing, and it's going to feed them oxygen. That bodysuit will be hooked up to an oxygen tank that will feed them oxygen, so they're not even breathing the air in which the virus may be contained, for instance, if it's in the lab. So that's the difference in those two things.
And how about being in nature? How is that effective? How does that positively affect us? Being outdoors.
Well, this is an oxygenated environment. It's a very open environment, and it's oxygenated because you have all of these live plants, trees, grass, rich in chlorophyll, that basically the body is using. The particular organs that would use this again are your lungs, because this is where the virus is situated at. And so this is not like using these AVAC machines or any of these other machines that will offer pressure oxygen to the lungs for a sustained period of time, where the body is not designed to receive that. This is what the body is acclimated to. It's designed to receive oxygen from the plants and give off our carbon dioxide from our body. So this would be your best place in terms of your healing environment, and it would be a very safe place. You have space. You're not in close communication with other people. You're not in close contact with other people, and you can still reap the benefits of a highly oxygenated environment.
If anyone that's watching this live have any questions, please feel free to type them in. Dr. Divine is a holistic physician of 25 years or more. You're welcome to ask any questions, and he will gladly answer any questions. Do you have anything else you want to share?
So my background and most of my work is in immunology and ecology. So I would place a lot of emphasis on how the immune system works, to make people understand that if they're using a mask, what are the benefits or the pros and cons, I would like to say, if they're using a mask. So the pros of using the mask, you don't have to take a direct hit from someone who sneezes in your face or coughs in your face, who may be carrying a virus or may not be carrying a virus, but we don't know that. And because of the lack of knowledge of what other people have, then it's better to err on the side of caution. That's number one. Number two, a lot is not known about this virus, and this virus still has not reached its stage of mutation where they can say, okay, the specialists can actually come out and say this virus is only manifesting as these particular symptoms, whether it's lungs, kidney, some of the other symptoms that had came up with the prostate. They can't put it in that strict category as yet. And when they did, and when they were leaning toward that, along comes this new particular virus that has been is an offshoot of the coronavirus that's been impacting younger children. And of course, at first they thought, hey, the virus won't affect African Americans because that was rumored. And then they said, well, it won't affect children because that was rumored. And we're seeing all of those things happen. So when I say err on the side of caution, one of the pros is to wear the mask, because we don't know what the virus is actually doing. We don't know all of how it's going to make its changes, what it's going to do the next coming season. A lot of questions that aren't asked. A lot of questions that are asked that aren't answered. Can you get the virus more than once? And I tell people, if you got a cold more than once and the strain of the cold change, then it's likely that you can be reinfected with the cold. Even if the cold does not change, and I'm comparing the virus to a cold because a cold is a virus, I'm comparing coronavirus 19 to the common cold. In the sense, not to minimize it, but just to show how it works. If your immune system is not in a place where it can actually resist the second infection or exposure to this same virus without it mutating, then again, you're going to get sick again. We have to understand that. the other thing is, one of the questions I don't hear asked, and is not asked to Dr. Fucci, and is not asked to Dr. Is it Fucci or Fauci? Fauci. Okay. Is that if people get infected, is it a permanent infection? Like, does it work like the HIV virus or like a herpes virus? Does it find its way into the system, into the muscle tissue or the nervous system in some way, embeds itself in the body and then stays, and then have different flare-ups at different times? That's one of the questions that I haven't really heard asked to the other professionals in the field, the epidemiologists, the virologists regarding this virus. But I think it's a important question to be asked.
Well, how about eating? And a lot of people have been talking about building the immune system, juicing and eating certain foods and staying away from certain foods. How does that make it a positive impact?
Nutrition is always important because nutrition is what rebuilds cell tissue. And if the cell tissue is healthy, if the blood is healthy, then it's gonna regenerate healthy cell tissue, especially cell tissue that